Thank you for inviting me, Kenneth and Henry. I don't see my notes, but whatever.
I'm afraid, the notes are not available.
We don't have the notes on the... Okay. So I wanted to tell you a bit of who I am. I'm a community-based research officer. Too low? Okay. Yeah. I'm a community-based research officer for the association STis in France. And everything that I will present to you is based on the experience of our peer workers that are working in prep settings on trials or studies, and also on many prep consults throughout France, and also on the experience of prep users that reported it to me through counseling, because I'm also a sexual health peer counselor. I've got no disclosures. First, I wanted to start by settling some context for my presentation, because we've been talking a lot about STIs as being the new plague. We've seen many articles, pictures during these 2 days of presentation together. And also, everyone is aware about the decline in condom use, but at some point we should question ourselves to know if it's going to go back to pre-HIV levels. And we are talking about STIs and sexual health, and I'm seeing people every week, and my coworkers are seeing people every week, and STIs concept and what you put around the term STIs and sexual health are very blurry concept for most of the people we see in France, at least. Sexual health is not a concept that is commonly understood and taught, and so it's quite a work to go around this issue. And we are working in a very curative-orientated health system, not really preventive-oriented health system. When we go for looking for STI management in PrEP consult, I would say that PrEP visits every 3 months or 4 months, depending on the setting, is a really new setting, and it created a health pass for HIV negative persons that was not pre-existing to my knowledge. And it allows regularization of STI screenings and early treatment of STIs, but also it helps us work for partner notification or being notified by its partners about STIs too. But for ED, when we went into the first PrEP trial, we participated which was the Hyper-Gay trial. It was not about just PrEP and STIs. It was about addressing the full spectrum of sexual health through this regular consult. And so we decided progressively to build a sexual health path for the PrEP users. And we were the peer workers in charge of doing the counseling, and we're still doing counseling in those studies and also out of those studies in most of the places we can do it. And we built this program to address at different visits, different themes about sexual health. And first it was really about barriers and levers to adapt PrEP and integrate it in your life. Then 1 month later, we start to looking at your knowledges about STIs and the different combination tools for prevention and how to adjust them into your life. And then 3 months later, we would address many other questions that was not reasoned before in the 2 previous counseling, and so that we can really cover the full spectrum of sexual health. And then 6 months after, we are looking at the road we've been on and what has changed since you started PrEP and what is left to do. But after 6 months, we don't do systematically counseling. And you have to understand that we work in the health centers. We don't do that outside of it. So each time a PrEP user is coming in France to see its doctors, he also sees a sexual health peer counselor. And so, well, that was just to show you where we are located in the process. So we are really working inside of the centers, but also outside of them for animating self-support groups and, if someone needs it, enhanced counseling. And we are also acting on social media. You have Prep Fact in English, and we have Prep Dial for French speakers. We are also very available outside of the visits, because we think that it's a very big benefit for the PrEP users that we are available around the clock, not at night because we sleep, but we've got a French system that is led by another association that answers through phones to any demand you have, and especially about PEP at night, as PEP is a huge complementary tool for PrEP. And so our peer workers posture is a professional posture, but we try to be closer from the users, PrEP users, than the medical professionals. Not really friends, we remain professional, but really closer, so that we create a trustworthy relationship, and that allows them to tell us anything they want, especially what they don't tell to their doctors too. And we are making use of all personal community experience, as well as all the experience that is shared by the other PrEP users. And we also use informal language and tutoiement, which is familiar you in French, because we have a formal and a familiar you. And our idea is to empower, not to educate, because we don't want to be in a relationship where we want to be in a horizontal relationship with PrEP users, and we want to be acting as a bridge between medical universe and your daily life. But we have to acknowledge that there's limitation to PrEP programs, because we've created a sexual health pass through PrEP for HIV negative persons. But there are just a small proportion of STI vulnerable people, in fact, and PrEP users lose the benefits of this regular STI testing when they stop using PrEP, or at least they lose the benefit of the facilitation. They still can go and get tested for STIs, but they don't get, in our system in France, you get an appointment at the end of your visits. You get already the date and the time of the next appointment that you choose, and that doesn't exist to help you regularize your STI testing outside of PrEP programs. And also, peer workers are not funded for PrEP, outside of the research settings. So it means that all my fellow peer counselors that are working on PrEP programs all around France, and there's over 70 sites where we go through France, they are not paid to do that. So we are privately funding it through donation, but this will not work for long, because we have a setting in France where there's a lot of small units that deliver PrEP, not many very large PrEP delivery settings. And also, there's a global and almost total lack of sexual education now in France, which put us at much stress to transmit information to the person, the PrEP user that we see. But as not everyone wants, need, or is ready to use PrEP, and that outside of PrEP follow-up, mostly people go when they've got symptoms to see a doctor to check for STIs, we need other solutions. And ED, the ED Association, is also very orientated on screening, and we've got a lot of outreach activities to offer HIV screening. And we did in 2013 a survey to understand how people were happy about this rapid HIV testing. And we also included a space for them to express what they want us to add to this. And so we discovered that they had, well, we had the idea, but we discovered they had a huge various need for sexual health services that we could not afford at the moment. So we started to thought of what could we do to change that, and what could we implement. But at the same time, we had also information through PrEP users telling us it was extremely difficult to find friendly and respectful healthcare providers, as they were having a lot of experience of stigma through health settings. It was hard for them to identify resources, professional instructors where to go just simply when you've got something itching or burning, where do I get treated for that? And we lack access, as a matter of fact, to demedicalized rapid STI testing or home test or home self-sampling in France. We've got HIV and HCV, which is sometimes better than in other settings. As we've seen, it's not possible to do demedicalized testing for HIV in Netherlands. But we would like more, of course, because outreach is really working and we need more tools to do it better. And also in France, we've got a real lack of regular proctology and gynecology exam, and we really need to promote better vaccination for HPV, HepA, HepB, maybe HepE. We will start to have case of HepE in France and others. So HELP developed in 2011 tested a response developing sexual health offers which makes peer workers at the center of a network of other health professionals working also with STI clinics to organize complex paths for any kind of people who needs it, but they based it on a local diagnostic of the population and the need of the population in different cities in France. And so at the moment, it's still it's working in different settings in France. That was one of the answer we developed. We created also sexual health community centers called Le Spot, one in Paris, one in Marseille, and there's 3 more in development. And we are still ongoing the implementation of research to test new tools. And we've spoke about this morning, I think, about the Clammy Web study that has been done in France, and now we are working with Santé Publique France, who's done Clammy Web, to do another study, but addressed to MSM population to test male kits for STI home sampling. And also we are testing to give result at their choice, either by phone, through a GP where it's sent it to, or through a partner checkpoint. And also, we are testing giving positive results by phone for any STI that is tested, because we are not doing that at the moment. We are not allowed outside of research setting to do that, but we think it's working, so we're testing it. And also, we are working to create a sexual health app system that is working either for clients, for care workers, and for peer workers with different apps for each type of them. And the idea is to help people regularize their STI checking or help them in their PrEP adherence, and also centralize the data that are collected by the healthcare provider and by the peer worker, and let people all talk together through this app for the better health of clients. And so a few advocating things that I would like to promote today is that we really need more outreach tools. I said it already, and we need more access to those rapid STI tests and home tests or home self-sampling. We really need also to improve on vaccination and gender-neutral HPV vaccination, because it's completely crazy for France. And we would also like to work on PEP demedicalized starter kits or initiation kits, because we have major issues to have people accessing PEP. It's widely accessible, but no one goes to it because no one knows about it. So we want to give it directly to people. And so to end this presentation, I just wanted to say, so we've created this system of PrEP setting where HIV negative people goes, but at the same time, if we are not working on outside of PrEP regularizing STIs through another path for HIV positive and HIV negative people who don't use PrEP, we won't be able to correctly refer people to PrEP, and we won't be able to treat them correctly and treat STI correctly outside of the PrEP setting. And so just to end, I started my presentation about the idea that STI is a new plague. I just wanted to advocate for you all don't feed a moral panic about STIs, because I see more and more people that are pressed to use a condom again at 100% because of the fear of this damned gonorrhea resistance. And I hear a lot of people being tired of, they have the impression that now that HIV fear is lowering a bit for them and they can have a more peaceful sex life, that we're trying to replace this fear by STIs, and that is not a good idea. It doesn't go on the side of having a better sexual health. So I wanted to end by thanking all my the participants of the Hypergay trial and Prevenir study, but also my fellow peer workers from these different trials and the staff from the hospitals where we've been to, and also the NRS and the investigators of the studies have been participating. Thank you all a lot.